Hello, everyone. I hope you're doing well. I'm really happy today to present to you my presentation on the global battle against cancer. So a little bit about me. My name is Medha Lolayekar, and I'm a rising junior in Lynbrook High School located in San Jose, California. I'm a pre-professional dancer for the Chitresh Das Youth Dance Company, a badminton player on my school team, and I love to craft and bake. For my extracurricular activities, last summer, I participated in a research program where I worked side by side with a postdoctoral associate at Will Medical College of Cornell University, where I researched a potential targeted treatment for AML. I also led a team to fundraise money for the Leukemia and Lymphoma Society during their annual Student of the Year program. And more recently, I've joined a congressional campaign as a fellow and a team lead with key objectives to promote policies that optimize healthcare spending. For my future plans right now, I'm hope to go into pediatrics, but I have yet to decide what I want to do. So I'd like to open up my presentation with a statement from the World Health Organization. According to WHO, cancer is the predominant global health problem and one of the leading causes of death and disability globally. In 2020 alone, as per the Global Health Observatory, the estimated number of deaths from all cancers was nearly 10 million, and more than half that number came from low and middle income countries. Worsening global population increase, and exposures to risk factors will lead to an increase in global cancer burden. Through a deeper understanding of the main causes of cancer, we can attempt to answer the question, what is doable to control the situation? It's important to shift our focus to developing countries, from understanding the main causes to identifying key challenges within low and middle income countries. My presentation will assess the current distribution of preventative cancer measures worldwide and how we could potentially decrease cancer cases in the short run. So some background information on the main causes of cancer, starting with tobacco. More than 80% of the 8.3 million tobacco deaths in 2030 will be in low-income countries and middle-income countries. Smoking contains chemicals that can enter your bloodstream and damage parts of your DNA, leading to cancer. Next, we have diet and lack of exercise. 50% of all cancers diagnosed in women and 24% of those diagnosed in men are associated with overweight and obesity. Obese people have a chronic low-level inflammation, which can, over time, cause damage to DNA, thus leading to cancer. Next is UV radiation. About 90% of skin cancers are associated with exposure to UV radiation from the sun. It's not certain how UV radiation causes cancer, but many studies have confirmed that sun exposure can lead to cancer. Another cause of cancer is infections. Infections are the main cause of cancer in low-income countries and rural settings, accounting for 40% or more of cancer in low-income countries. Infections can disrupt cell growth, weaken the immune system, and cause inflammation, all of which could lead to cancer. Next, we have hereditary cancer syndromes, which includes abnormal genes being passed from generation to generation, or certain exposures between family members. Lastly, we have carcinogenic pollutants, also known as air pollution. These are substances that can lead to cancer. These pollutants can lead to cancer through a similar process to smoking. So let's look into how preventing and treating cancer varies between high-income countries and low-income countries. In Africa, more than half the countries have no radiation therapy centers. Radiation therapy is the most common way cancer is treated. These countries are home to about 198 million people, and by comparison, the United States has over 2,000 radiotherapy centers for its 320 million citizens. Overall, high-income regions spend 5 to 10 times more on healthcare per person than low and middle-income countries. As a result, 60% of the people with cancer in low and middle-income countries die from their disease. High-income countries have access to cancer screening programs to detect cancer early and have access to public health campaigns which educate people on different cancer risk factors, such as smoking. On the other hand, many low and middle-income countries don't have access to basic resources for cancer treatment. A startling statistic from the World Health Organization, according to WHO, 60% of the world's new cancer cases are diagnosed in low and middle-income countries. So what are the key challenges in low and middle-income countries that prevent them from decreasing the cancer burden? To start things off, one major problem is that there aren't enough healthcare workers or specialists to treat the many ill people in the areas with high cancer burden. Tertiary care institutions are few and far apart, and most of the time don't have staff with expertise to treat complex conditions. Limited human resources, trained health professionals move to work to urban regions, join for profit health sectors, or migrate to high-income countries. Thankfully, WHO has developed a global strategy on human resources for health called Workforce 2030. Its task is to make recommendations to stimulate and guide the creation of at least 40 million new jobs in the health and social sectors, and to reduce the projected shortfall of 18 million healthcare workers, primarily in lower and lower middle income countries by 2030. Another challenge for low-income countries is availability of technology and equipment. Too few radiotherapy machines for the needs of the population, with more than 20 countries having none. Many machines are idle or broken for lack of maintenance, expired sources, or lack of radiotherapists or physicists. There's also a problem of maldistribution, with many countries having one machine for millions of patients, compared to one per 250,000 in high-income countries. Since 2005, the International Atomic Energy Agency, or the IAEA, has been at the forefront of delivering aid to low and middle-income countries. They have built new departments and established education programs and training networks. Lastly, people in these countries have lack of education, and as such, don't know how to prevent or detect cancer until it's too late to treat. Some cancers can be detected early by screening, and many by education about early signs of cancer. It's estimated that educating people on cancer could prevent up to 1/3 of new cancer cases and increase survival from another 1/3 of cancer detected at early stages. WHO has produced many valuable guidelines and resources for the effective implementation of national cancer control programs, including the Framework Convention for Tobacco Control and global strategies for diet and exercise, reproductive health, and cervical cancer. For my conclusion, global problems need global solutions. To reiterate from earlier in the presentation, cancer is a high priority disease that is still given too low a priority in developing countries. Though many initiatives have been put out by WHO and other organizations, even today, 27 out of the 53 countries in Africa still don't have one radiotherapy machine, and there are still too few healthcare workers to attend to the population. In order to combat this increasing cancer burden, we need to help push initiatives to focus on the three key challenges. A good place to start would be with educating people on cancer risk factors. There are many organizations out there trying to make a difference through education. One organization being the Mali Rising Foundation, as a mission to empower the children of Mali, West Africa, by expanding and improving educational opportunities for them within their own villages. As the next line of global health leaders, you can make a difference worldwide through volunteering and advocating for better treatment of cancer globally. You have the power to give hope to people across the world. Thank you so much for listening. Here are my references. A few acknowledgements I'd like to make for my parents, who I really enjoy their endless support, for the Global Health Conference team for this amazing opportunity, and for all of you for listening. Thank you. If you have any questions, please contact me. Here's my Gmail.